Medicare may not be all it's cracked up to be. There are many big gaps in original Medicare, benefits that you may assume are covered or may have likely been covered if you've had insurance through your employer in the past. Now, that doesn't mean that original Medicare isn't good insurance. It absolutely is. But you need to know what benefits aren't covered so you don't wind up with big bills. Now, we've had countless people call in a panic because some of the benefits that they need and assumed are covered aren't. And sometimes they're not able to get coverage in time. That being said, of course, we've got thousands of success stories. Now, you may not think that all of these benefits are important, and maybe you already have solutions in place. But I promise you, at some point or another, you're going to need at least some of these benefits. And make sure to stay tuned because I'm saving the biggest surprises for later in the video. First, let's talk about dental benefits, because dental benefits are not covered at all by original Medicare. Now, perhaps you've been fortunate enough to never need emergency dental care, but I certainly have. And at that point in time, I really didn't know much, and I was enrolled in a pretty crummy dental plan that my dentist actually didn't accept, and I ended up on the hook for thousands of dollars in bills. And I know this is more common than you may think. There are a few big problems with dental insurance. There's the issue of networks with DHMOs and PPOs. There's the issue of waiting periods. And then, of course, those plan limits. If you're somebody looking to save money, you may opt for the least expensive dental plan available to you. And it's likely that that will be a DHMO, which is the dental version of an HMO. However, that only provides coverage for in-network. So if your dentist doesn't accept your plan, then you're out of luck. Then there's also the issue of waiting periods. Many dental plans have waiting periods for major services, things like root canals. And of course, these are the type of emergency services that you can't put off for 6 months. If you've ever had a toothache, you know that you really can't wait. And who amongst us has waited until they needed emergency care to actually bother looking into the specifics of their dental plan? This is when one of two situations arise. Either A, you have dental insurance, but you never really thought that much about it, and now you've realized that A, your dentist is not in network if you have a DHMO, or your plan limit just isn't enough. More on that in just a moment. Or B, you have no dental insurance whatsoever, and now that you really, really need it, you may have to wait months in order to have coverage for that very much so needed dental care. Luckily, there are plans that don't really have these waiting periods, or there may be loopholes that you can take advantage of. And this is definitely why you want to work with a broker, especially if you need dental care now. Another big problem with dental insurance are their plan limits. Most of these plans tend to tap out somewhere around $1,000 or maybe $2,000. And who here has had dental work that costs more than that? Now, there are plans with much higher limits, so make sure to check out our video about our client's favorite dental insurance plan. Dentists and most medical professionals agree that there is a strong correlation between your medical health and your oral hygiene. Actually, there was a recent study that found a staggering correlation between patients who didn't brush their teeth while in the hospital and those with acquired hospital pneumonia. I've even read articles and watched some videos about dentists who are able to bill to their patients medical insurance. Of course, that is extremely uncommon, and honestly, I haven't found an example with Medicare, but if you have, let us know in the comments below because your dentist deserves some publicity. So to summarize, Medicare, original Medicare, does not offer dental benefits. However, there are many private standalone plans that are pretty inexpensive. And then there's Medicare Advantage if you do choose to go the Medicare Advantage route. Medicare Advantage plans very often offer additional benefits like dental. That being said, make sure that the dental benefits offered by your Medicare Advantage plan suit your needs. If you wind up with a DHMO or a plan with waiting periods or a low limit, then it may not be the best plan for you anyway. 1 in 3 people over the age of 60 and 1 in 2 over the age of 85 suffer from hearing loss. And yet hearing is still not covered by original Medicare. Now, hearing loss when left untreated can lead to social isolation, and it's actually been linked to dementia as well. Without insurance, which, as we've discussed, Medicare does not provide, an audiologist-fitted prescription hearing aid can cost thousands of dollars. Now, luckily, recently, they have started over-the-counter hearing aids, which can be found in drugstores, and these can be found for a few $100s instead. And they can usually be used via app on your cell phone. Now, if you do need more specific care, perhaps a prescription hearing aid under the guidance of a doctor, then there actually are insurance plans that do cover it, however, they are limited. Now let's talk about vision, also not covered by original Medicare. Or at least not if you need corrective glasses or contact lenses. However, original Medicare does provide some vision services. For example, eye exams if you have diabetes, glaucoma testing, and macular degeneration testing, and of course, treatment. Now again, many Medicare Advantage plans will offer some type of vision benefits, but please proceed with caution with regards to Medicare Advantage. You can also purchase a standalone plan, which are truly inexpensive. They range usually somewhere between $5 to $30 per month. So if you're somebody that needs prescription glasses, this is definitely the way to go. It's going to save you a lot of money. And whether you wear glasses or not, if you like what you're seeing, make sure to like and subscribe. And remember, at iHealthBrokers, we are licensed nationwide, so feel free to reach out with any questions in the comments below or at the number on the screen. Of course, there's absolutely no charge for our services. A routine physical exam is not covered by original Medicare. What? In a way, this comes down to really some minute details and possibly some medical coding. And this is why you absolutely need to be informed and be your own advocate, because it's estimated that somewhere around 80% of medical bills have some type of error, very often due to medical coding. So please stay informed so that if you do need to dispute a bill, you have solid ground to stand on. There are a few different types of regular doctor's visits according to Medicare. There is the Welcome to Medicare visit, the Medicare wellness visit, and then a routine physical exam. These are the three basic, quote-unquote, regular types of doctor's visits according to Medicare. There's the Welcome to Medicare visit, the Medicare wellness visit, and routine physical exams. So you're going to see that there is a lot of crossover, and there are a lot of similarities. The differences are rather minute, but what really sets these apart additionally are the timing of them and really the purpose of them. So the first visit is the Welcome to Medicare visit, which is of course your welcome visit. Now this must be completed within the first 12 months of enrolling in Medicare Part B. During this visit, you will review your medical and family history. Your doctor will take some routine measurements such as height, weight, blood pressure. You'll go over your list of doctors and prescription drugs. Your doctor will schedule preventative screenings with you. He or she will look for any signs of impairment, dementia, memory loss, signs of frailty, and you'll go over your health risk assessment, which is basically a questionnaire. Then there is a Medicare wellness visit. This visit is very similar to your Welcome to Medicare visit. However, this one comes down to the timing. So, a Medicare wellness visit is after you've been enrolled in Medicare Part B for at least 12 months, and it cannot be within 11 months of your last Medicare wellness visit, or it won't be covered, because both your Welcome to Medicare visit and your Medicare wellness visits are completely covered by Medicare. Again, you're going to review medical and family history, take those routine measurements, go over your list of doctors, possibly update them. You'll schedule your preventative screenings, you'll do cognitive wellness exams, and your doctor will put together, any type of medical advice that they feel is necessary based on your current health. And then there are physical exams. These are not covered by Medicare. And these are really meant if something's bothering you, something that you might go to the doctor for, if you're sick, if something's bothering you. Again, you'll review medical and family history, routine measurements. They're going to assess your risk factors based on your health. They're going to do a physical exam of your lungs, head, neck, brain, your abdomen, whatever it is that is bothering you. They'll test your reflexes and your vital signs and send out for blood work or urine analysis. And these tests are all going to be billed individually. So this is the type of regular exam, quote unquote, that's not really covered by Medicare. So you will have to pay for some portion of it, and again, all those tests individually. So make sure to time your visits correctly so that way you don't receive a charge. And if you do receive a charge that you know is false, make sure that you are charged for the correct type of doctor's visit. So did you know that prescription drugs actually aren't covered by original Medicare? Now there are some exceptions. If you'll see Part B, which is basically your medical insurance, covers things like ambulance services, clinical research, durable medical equipment, limited outpatient prescription drugs, more on that in just a second, mental health and substance abuse disorders, and oxygen equipment and accessories. So here on Medicare.gov, if you were to click here where it says limited outpatient prescription drugs, these are really the types of prescription drugs that are administered by your doctor or by a vaccine. So this is the full list, but basically, again, we're talking about vaccinations, drugs administered by your doctor, chemotherapy, and oral anti-cancer drugs. But this is the full list if you want to take a look. Also, insulin will be covered under Part B, but only if it's administered via pump. If you take your insulin, otherwise that it would be covered under Part D or a Medicare Advantage plan, which we're going to talk about in just a second. So let's actually look at Medicare Advantage and Part D plans. Again, Medicare Advantage, please proceed with caution. So let's actually look at Part D plans first. It's going to ask you a series of questions, but just put I don't get help from any of these programs right now, just so that we can look at the plans. If you know what drugs you take, then this would be great. That way you could compare the costs. All right, and here are the plans available. You'll see this in most states, in most areas, that there is at least one plan that's under $10 a month, possibly even $0 per month. And that's a really good thing because there is a Part D late enrollment penalty. If you go for a period of more than 63 days without creditable coverage, then you could be charged the Part D late enrollment penalty. So it's not a significant penalty. It's not anywhere near as significant as Medicare Part B. But if you have a plan available to you that doesn't cost you anything, then why wouldn't you sign up, even if you're somebody that doesn't take prescription drugs at this time? So these are the Part D plans available in the area I put in. You can also, if you are going to go the Medicare Advantage route, look at Medicare Advantage plans that include prescription drug coverage. Now, not all plans do include prescription drugs, but if you are going the Medicare Advantage route, then it certainly makes sense to get one that includes drug coverage. And you'll see with many Medicare Advantage plans, they list themselves as a $0 monthly premium. That being said, at the very least, you need to continue to pay for your Part B. Now let's talk about a big one, which is long-term care. And let me show you why. So this is where things get confusing. On Medicare.gov, there's a page, What Part A Covers, and it lists inpatient care in a hospital, skilled nursing facility care, behavioral and mental health, hospice care, home health services, and nursing home care. And these two are really what confuse people the most. So if you click here on where it says nursing home care, and it really should be asterisked, and this is why. Nursing homes are facilities where people can live and get full-time medical care on a long-term basis. Most nursing home care is custodial care, which helps people with activities of daily living, more on that later, like bathing, dressing, and eating. Original Medicare doesn't cover custodial care, so I don't know why they list nursing home care and don't asterisk it in some way, because basically then it goes on to say original Medicare may cover skilled care at a nursing home. So it's really very confusing, but what it breaks down to is Medicare is not going to cover long-term care or custodial care. So nursing home care and skilled nursing facility care is not the same as long-term care. And when you think of nursing home care, and this is really where the confusion comes into play, you're probably thinking of a senior living facility or some type of assisted living facility, and this is not covered by original Medicare. Skilled nursing facility care, or nursing in-home care, is meant to provide rehabilitative or habilitative services after a hospitalization due to an illness or an injury. Any type of long-term conditions would disqualify you for this, something like dementia, for example. Long-term care is really meant to assist with ADLs, or activities of daily living. So these would be things like bathing, dressing, toileting, eating, transferring, which is basically just getting in and out of a chair, and continence. These are the things we talked about earlier in the video when we were on that Medicare part about what Medicare Part A does and doesn't cover. And these are the activities of daily living that would make you eligible for custodial or long-term care, which is what Medicare does not cover. Now, there are a variety of different long-term care insurance plans, and I highly encourage you to look into those because long-term care can be extremely expensive. We go into that in more detail in this video here, and make sure to check out this playlist as well to learn more about Medicare in general. Don't forget to like, subscribe, and leave a comment with feedback or questions if you have any. We'll see you next time.